H1N1 influenza cases are on the rise in India as over 1,300 cases have been reported in the national capital, New Delhi. The number of cases have reportedly risen by almost six-fold as compared to the same period last year, where 229 cases had been reported in New Delhi. Doctors say that most H1N1 infections are generally mild, with fever typically subsiding in 3 to 5 days, but they also caution that elderly people and children with diabetes and heart diseases are at a high risk of developing complications. According to AIMS, influenza cases have been on the rise owing to a drop in temperature in the ongoing monsoon season. Some of the common symptoms include sore throat, nasal discharge, dry cough and headache. It added that patients diagnosed with H1N1 virus, they must isolate themselves at their homes for 2 to 3 days. The institute has also urged patients to use a face mask. Meanwhile, the government has issued an advisory containing a list of do's and don'ts for the general public. Now, under the do's, people have been advised to cover their mouth and nose with a handkerchief or tissue while coughing or sneezing. The advisory urged people to wash hands regularly with soap and water or use alcohol-based hand gel. It also advised people to not touch their eyes, nose or their mouth and avoid visiting crowded places. The advisory has urged citizens to maintain an arm's length distance with those affected, while also recommending adequate rest, sleep and nutrition. Meanwhile, under the don'ts, citizens have been advised to avoid shaking hands or hug people while greeting. The government also advised people to avoid taking medicines without consulting a physician. The advisory also urged citizens to avoid visiting relatives and friends while being symptomatic. Those affected have been advised to visit their nearest medical center if the conditions worsen. And this includes high fever, difficulty in breathing, bluish discoloration of skin or lips, or blood in sputum.